Welcome to another episode of the Radical Healing Podcast. I'm your host, Jess Betancourt, certified hypnotherapist, and my guest today is Brett Cordes. And Brett is a recently retired ear, nose, and throat physician and surgeon who is now launching his own private physician coaching business. His career was almost completely derailed as he battled the disease of addiction. However, through consistent hard work, founded in humility, he was able to rejoin the career that he had always loved and is now coaching physicians with symptoms of burnout and substance abuse. Hi, Brett. Welcome.
Hello, thank you so much for having me.
Tell us where you are. You're in Louisiana, right?
I am. I'm in Baton Rouge, Louisiana.
Oh,
Yeah,
awesome. Cool. So good to
yeah.
have you here. So I love you have a really beautiful, amazing, and powerful story as well as the work that you're now doing. And I'd love to have a conversation that gives more information about both. But as you were just telling me before we started recording that you were diagnosed with cancer when you were 19, is that right?
That's correct. Yes, I was completing my first year of college at LSU in Baton Rouge, and it was late March, early April, and I just came down with like a what I thought was a bad cold. And long story short, it was non-Hodgkin's lymphoma, and so. Um, Within 3 weeks, I was in Houston, Texas, in the Texas Medical Center at MD Anderson, and was again the diagnosis was made, and I had started chemotherapy within, I think, 2 to 3 weeks of those first symptoms, and ultimately battled the disease, cancer, for 16 months because it recurred once. So I had 6 sessions of chemotherapy from April through August of 1996. And then the cancer came right back during my radiation therapy. And then I had another 6 months of chemotherapy. And then ultimately, the treatment culminated in a stem cell transplant.
Mm.
So it was a long road. Um, but there were several positives that came out of that. Honestly, one being, when I was diagnosed, I had no idea what I wanted to do with my life. I knew that I liked science, and I knew that I liked history. So I was actually a history major. But after being a patient for a year and a half and kind of seeing some of the uh, positives and negatives of medical care, I decided I wanted to be a doctor and kind of pay it forward. So um, I just kind of started taking more science classes so I could go to medical school and follow that path. Because before that, I had no idea what I wanted to do. Um, but unfortunately, also during those 16 months of cancer treatment, that's where I was first introduced to opiates, which are painkillers for any listeners that aren't familiar with terms. But much later in life, I became an opiate addict. But I was first exposed to them after, I was given painkillers during my cancer battle after, little minor biopsies. It wasn't a painful cancer. The treatment wasn't painful, so pain wasn't a big symptom that I was dealing with. But I knew that I liked the way that they made me feel. I
Mm-hmm.
didn't I didn't love it at the time. At the time I was 19, 20 years old. And I actually wrote a memoir about my experience with cancer, and I remember writing that they felt like 3 or 4 beers, um,
Mm-hmm.
without the hangover. So I liked the way that they made me feel, but it never occurred to me to continue to take them after my pain went away. Um,
Mm-hmm.
and I don't know how many bottles of pain medicine I was given, but I never finished a single bottle. It just never occurred to me to take it once the pain went away.
Mm-hmm.
So my first exposure to opiates um, did not turn into an addiction at that time.
Uh-huh.
Um, so graduated college, and I've been healthy ever since from a cancer standpoint. So
That's
um,
awesome.
yeah, yeah. So finished college, went to medical school, decided I wanted to be an ear, nose, and throat surgeon. about halfway through medical school and matched, um, ironically enough, in Houston at Baylor, which is exactly where I was treated for my cancer.
Wow.
So 5 years of training as an ear, nose, and throat physician and surgeon. And then I joined a private practice inside the Texas Medical Center, and began working. This would have been in 2009. So at this point, I'm 32 years old, and I'm really starting my first real job ever in my life. That's one thing about being a physician is, you don't, at least I didn't have any any other training. It was either be a doctor at this point, or I'm not sure what I would do. So
Or start
32
again.
years old. Yes, yeah,
Yeah.
let's start again, shuffle the deck and redeal them.
Yeah.
But you know, at this point, everything was going fantastically. I mean, really, I was living what I would define as the dream. I had a wonderful wife, and we adopted two children. And so, first 5 years of private practice was fantastic. Everything was what I would say perfect. I hate using that word.
But it
Um,
was ideal. It was,
it was ideal.
yeah.
Yes, it was ideal. And so, what happened around 5 years after being in private practice is I started to feel bored.
Oh.
And in hindsight, a better term was I was experiencing a lack of fulfillment.
Mm.
But at the time, I thought I was thinking I was just kind of bored because I had been, again, at this time I was
Oh,
36, 30.
Brett, I can't hear you.
You can't hear me?
You went mute somehow.
Can you hear me?
Yes. I'll just
Okay.
edit that little margin out.
Okay.
It says my internet is unstable, but I have full. Are you still there?
I'm still here.
Okay.
Yeah.
Okay, I'll just edit this piece out. So, in hindsight, what was happening was that you were sensing un being unfulfilled,
Yes, lack of fulfillment.
lack
And
of fulfillment.
so, and again, in hindsight, I was experiencing the arrival fallacy, which was essentially I had been climbing this mountain for my entire life. And prior to my cancer battle, we didn't go over it, but in my childhood, academics were a huge, huge priority. And my father excelled in academics and in athletics. My mother excelled in academics. My sister excelled in academics. So anything less than outstanding was not something that was acceptable.
Mm,
Not because they told me it was unacceptable, but because I wanted to reach their what I felt was their expectations for me.
yeah, it was like
Um,
the family legacy.
right, right. So I'm 36 years old at this point. I've been climbing this mountain and sweating and bleeding and trying and failing and succeeding and working as hard as I can, almost nonstop. And I get to the top of the mountain. This is 5 years into practice, and everything is going fine. And instead of being satisfied and learning to live in the present, the only thing I could think of was, okay, what's next? What's the next
Mm-hmm.
challenge? What else can I do? What else can I achieve?
Mm-hmm.
Because along the way, I had essentially almost become 100% dependent on external validation.
Mm,
I needed to win awards. I was used to receiving accolades and being told that I did a good job and receiving
yeah,
good grades on papers, and that stopped coming in after
right.
5 years of private practice, and again, what I thought was boredom was a lack of external validation and a lack of fulfillment, and it created this kind of low level of helplessness and powerlessness in myself, which ultimately became the trigger for drug use. And what happened, my routine was on Fridays I would go home and my wife and I would sit out by the pool, and I would open a couple of Bud Light Lime beers, and we'd kind of start the weekend and reflect on a good and successful work week. Well, what happened one Friday afternoon is that a drug rep had brought by a little cough medicine sample that was hydrocodone based, which is an opiate.
Uh-huh.
So I thought it would be a good idea to, instead of the two beers that Friday afternoon, let's just take this cough medicine sample home and pop that and see how that did. Because I remembered I liked the feeling of opiates from when I was a cancer patient. Well, this was a completely different experience because this time it was the ultimate euphoric feeling of belonging, of connectiveness and maximum fulfillment that I ever felt in my life. It was a euphoric feeling that I had never felt before, and that ultimately began a 6 year progressively um, severe addiction to painkillers. And fast forward to 2019, my partners find out about it. I lose my job. Everyone in the community finds out about it. Uh, I go to rehab for 3 months, and it was a very rough time, not only for me, but for my wife and for my kids. And, um, everyone in the community was certainly at least superficially supportive,
Hmm.
but you can feel you can hear the rumors, you can feel the stares. It's not something that my family deserved, and I can say that 100% without reserve, because it was my doing. They had nothing to do with it. So it was a rough time for us.
Um, if I could ask, I don't how this sounds, but like what led to the escalation where it finally like had to collapse in on itself? Like where was the point where maybe, I don't know if you realized or if it happened to you, it was like this can't go on. Like I cannot live like this.
Yeah, that's a good question, because it took a while for me to realize that.
Yeah.
Um, I would say about 3 years into it, when I was having to use every day.
Oh.
If someone has experience with alcoholism or drug use, again, I'll just talk about my own experience. But after about a year and a half, I had to use opiates to avoid the withdrawal symptoms. So,
Mm,
and the withdrawal symptoms would come within 8 to 10 hours of my last dose. So I was having to use on a daily basis, and it was becoming increasingly difficult to get the
mm,
supply. I was having to ration over the weekend because I would get them at work. And so about 3 years into it, when I was using every day and it was becoming harder and harder to attain that much medication to sustain my daily use, I started to think, okay, this is not sustainable.
mm.
But even then, I was thinking to myself, if I just had a reliable supply, I could do this indefinitely, because I'm just like everyone else. Instead of having a glass of wine when I get home, I use these painkillers. That's what my addict brain was telling myself.
That was your rationalization to justify
Right,
your behavior.
right, and I'm a physician, for Christ's sakes. My dad is a mathematician. I'm a very logical person, and the mental gymnastics that I had to do to justify this daily drug use as a
Hmm.
surgeon, as a physician who is doing surgery on patients, was just incredible. What I had to do to convince myself, but it worked. I mean, I convinced myself that not only was I a better father and a better husband on drugs, I was a better doctor and surgeon on drugs.
Isn't that
So
wild? That part of our mind that
yeah.
speaks to us like that to just justify to keep going.
Right. Oh yeah. I was convinced that it would be irresponsible of me to not use drugs, because I was more relaxed when I used them. I was
Wow.
more confident when I used them.
Wow.
It when I look when you look back when I look back on what I was doing and what I was thinking in active addiction, it's embarrassing, for one. It's horribly embarrassing, and it's scary to think that a brain, my logical black and white ones and zeros brain got so sick that I was able to convince myself that that was the right thing to do, you know.
Mm, mhm.
So, but rehab was probably the single.
I have a burning question, and I'm sorry.
Oh, sure, sure.
I personally don't have experience with opiate addiction. I'm just like, what are the withdrawals like that perpetuate needing more? Like, what is that physical sensation, or what is the mental experience of opiate withdrawal?
Okay, yeah. Um, okay, so the physical symptoms of opiate withdrawal feel like the flu.
Mm,
And if someone has experienced the flu is significantly worse than just a cold.
yeah.
So you've got bone aches, muscle aches, you have cramping in your stomach, you have chills, you have muscle jerks, you have a runny nose, you're sneezing, um, and the physical symptoms are really bad. But for me,
Mhm. Yeah.
that paled in comparison to the mental symptoms, which was an anxiety that was like a panic attack,
Wow.
but all the time.
Oh
So
my
it was
God.
like you were in a full blown panic attack indefinitely until you could get your hands on more opiates. So I definitely could not work in opiate withdrawal, in full blown opiate withdrawal.
Yeah.
And so
No.
that's why I was such a better doctor when I used drugs. You know, that's what I was telling
Right, because
myself.
the solution is to use again, or to create a different state before you get to the place where you're experiencing the withdrawal symptoms. Like, keep it at bay, right? And it's
Right.
that kind of like how we talk to ourselves when we're in the throes of addiction, is like, keep that away, because we're definitely a better person when we're more like this.
Right.
Yeah.
And this was around the time that I kind of formed my own definition of an addict, um, because I realized that I was using drugs to avoid emotions.
Mm-hmm.
Whereas in college, when I would drink beers in college, I was using beer and alcohol to kind of enhance my emotions.
Mm-hmm.
Um, or if I wanted to relax, it would improve the relaxation. If I wanted to be up and cheering from a football team, it would enhance that kind of
Mm-hmm.
attitude. Whereas with drugs and addiction, I wasn't trying to enhance anything. I was trying to dull and numb
Mm-hmm.
negative emotions. And
Mm-hmm.
that's when I realized the difference was
Mm-hmm.
around this time. Yeah.
Mhm. Yeah, I think it can be, drugs and alcohol can be used to whatever your intention is. You want to exacerbate this feeling of joy and celebratoriness. Well, let's get this substance to help us bring that up a few notches. Or if we're in a place of discomfort or not wanting to see something, well, then substance is also something that can be useful for that. Is so we tell ourselves, right? Which is how we get up in these messes. Is, and it's like, goes back to what you said. It's still an external validation that's coming from a substance, right? It's like, not, we're not
Absolutely.
solving problems internally. We're reaching outside of ourselves for something else to either turn this feeling up or make this feeling go away, because it can work both ways, as just as you're saying, depending on whatever you need it for, which is why it seems so convenient. And it feels like, I tell my kids that drug and alcohols are like a trap, because they're really little, so I'm not like in a full on dare conversation with them yet.
Sure.
But I'm setting the stage for, there's traps out there, and some of them are called this and some of them are called drugs, and to just watch it, they're like a trap, and so they might look really appealing, or even your friends might be encouraging you to partake of this, but it's definitely a trap, and I'm kind of like setting the stage in their minds to be on the lookout for this, because I feel like, I'm kind of like just jumping to, or sidelining your story here, but we're not educated enough around what actually drugs and alcohol use will do to us over time.
Yeah, I agree.
Their program was a fail. Sorry, but there's not enough open, candid, honest discussion, which is why I believe there's so much shame and self judgment and self criticism around those of us who have fallen into a trap and like taken it for a year's ride or decades worth of a ride, and we come out of it slower than we could because of the shame and the guilt and like the remorse that's surrounded that's shrouded in this place of like people don't talk about this enough. These stories aren't shared enough. The people who have come through the other side and have the bravery to have a public face or persona around themselves and be like, look, this is what happened to me, I think is so important. And so like I just want to emphasize that I really value you sharing your story here for people to hear and possibly see themselves in, or to feel, some sort of warning bells going off if they feel like, even if they are someone who's using pain medication in a prescribed way, like these are things that are really have a fine line.
Mm-hmm. Mm-hmm.
And you did use them in a prescribed way at first, but then also your brain remembered, oh, yeah, I really felt relaxed and calm when I was using this opiate. I want to feel that way again. Like I need to get to a place where I feel. And when you described when you took the cough medicine home, you were sitting outside of the pool with your wife and like just being surrounded by that feeling of like belonging and
Right.
wholeness. And it's like that is the trick of drugs. We can achieve those states in other ways through our own spiritual selves and our paths, but it's a little bit longer sometimes. And this is like an immediate taste of, oh my God, this must be what it's like, this euphoria.
Yeah. Yeah. And I also, you reminded me when I was talking about numbing negative emotions in early sobriety. And when I say early sobriety, I mean like the first few weeks. Something that I did not expect happened, which was I realized I was using opiates to avoid even positive emotions. So it wasn't just negative emotions. Any real high or any real low, I had completely lost any sort of coping mechanism for stress or anything beyond just this numbing baseline that I created for myself. So
Mm.
I found myself um, wanting to use an early sobriety when I was really happy, or when I was excited, or if I was proud of myself. Ooh, I know what would make myself even more proud.
Yeah.
And so it really, and someone described it to me in the context of needing help to beat addiction, because you're trying to fix a sick brain with the same sick brain, and so it
Mm.
doesn't. You need, or at least I needed outside help to do that.
Mm-hmm. How
So
how did you come out? Could you tell us more about that part of your journey?
sure. Sure. So I went to a 90-day residential rehabilitation treatment program that was 12-step based. So it was AA based.
Was this your
Um,
choice?
it was, well, my wife gave me an ultimatum, um, you know, to either get help, or our marriage wasn't going to continue. And at this point, I knew I needed help. So it didn't take much to convince me. But as a physician, and at the time I was in Texas, a patient had reported me to the medical board. So as a physician, once the medical board gets wind of this, yes, you are mandated to go to a 90-day treatment program. So luckily, I happened to go to one of only 6 that would have been sufficient, per the Texas Medical Board. So even though I went voluntarily, it was going to be mandated anyway.
Anyway, did
And
they take
so
your license?
what's that?
Did they take your license?
They suspended it.
Okay.
Yeah, they suspended it, and that was
While you
a
go to treatment. Okay.
well, yes, they suspended it, which was supposed to be for a year, and that suspension lasted 4 years.
Oh wow.
So, and COVID hit in the middle of this,
Oh my
so
God.
it was what was supposed to be a year out of work and getting better turned into 4 years, which is a completely different discussion. But let's just say, if I felt like I had a lack of fulfillment at year 5 of working, at year 3 of not working, that was truly a lack of fulfillment, and I barely made it out of that, to be honest with you. Um, but recovery in and of itself was difficult enough. But my recovery has been AA and 12-step based, but also using the principles of psychotherapy that I learned in rehab. So I kind of call it a hybrid, kind of an AA psychotherapy hybrid.
Mm-hmm.
Um, but it's been successful thus far.
Amazing. Could you tell us just like a little bit more about the details of the psychotherapy aspects that feel really relevant to you, or the ones that were the most successful for you?
Sure. It was kind of we did have some individual therapy, but it was mostly group therapy. And it was cognitive behavioral therapy. So the idea was to change the way we thought, because our thinking controls our emotions. So if we can change the way we think, we can change the way that we feel, and then ultimately avoid feelings that trigger our drug or alcohol use. That's the whole principle behind it. Um, but an AA principle that I found particularly useful was the the theory of when all else fails, just do the next right thing.
Mm-hmm.
And when there were bad days, I would break down the next right thing into 5-minute increments. I mean,
Mm-hmm.
I wanted to use so bad that I would say, okay, just for the next 5 minutes, what's the next right thing to do? Take a shower. Okay, get out of the shower. I still really want to use what's the next right thing to do? Get dressed and make my bed. I mean, that on bad days, I would break my day up into 5-minute increments.
Wow.
With saying to myself the whole time, just do the next right thing. Just do the next right thing. Um,
Yeah.
so that's an AA principle that for me was particularly helpful.
Well, that brings the world back into some semblance of you have control of like what are the immediate things in your proximity? Okay, your body, your environment, your home. What are you gonna eat? It's almost like being a baby, like
Oh,
how
absolutely.
really just be so tender and loving with yourself in this really delicate time. It's like care. Okay, what does like immediate care look like? Sometimes it is like taking a shower is like it's an event. A
Right.
major event. Yeah, and just to take it that small makes us feel more present and more embodied, less afraid of the what if scenarios, or like taking ourselves on a 2 hour journey into the future and planning on how we're going to go buy or get the thing. Because when you
Hmm.
start doing that, right, I've noticed when I've done that and I work with clients, they're like, I already know that I'm going to drink tonight. Some people will say,
Hmm.
right? Well, yes, because you've sat around and pondered about it and you've already mapped it out and like figured it out. You've set it into the future. And now all your body has to do is go follow that blueprint that you've already created. So what you're saying is really important and powerful because you're like, no, 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 no. We won't go there. Like we're not even going to mentally go there because that makes the behavior really strong and it makes it almost inevitable that it's going to happen. Let's take that back to what's in the next 20 minutes. Okay, maybe that's too much. What's in the next 5 minutes in this moment when I'm feeling really strong cues and triggers and desires to take or to use. So I think
Yeah.
that's a really, really helpful tool. Thank you for bringing that one to our attention.
Absolutely. And just in that, what you had just been saying, it brought up a few other psychotherapy principles. The first one being really AA related, but another principle is, in fact, that's exactly what my counselor would refer to early sobriety as, which was you need to treat it like you would treat a newborn baby.
Mm-hmm.
So, um, you know, you keep away triggers, you separate yourself from dangers, you try to uh, avoid proximity to your drug of choice. You surround yourself with a support system.
Mm-hmm.
So he would always say, treat your early sobriety like a newborn baby. And then, of course, the illusion of control. I anxiety was certainly a trigger for me, but when I learned that the only things I can control in life are my own thoughts and my own actions, and that is it. I can't control what other people think about me. I can't control how other people receive me. I can't make other people think of me a certain way. And it takes practice for me. I mean, sometimes, certainly every week, if not daily, I remind myself what I can and can't control. Because when I am living a life in the present and I am living a life along my truth and I'm not trying to control things, my anxiety level drops tremendously.
Mm. That was going to be my next question was how do you manage anxiety without using? And it sounds like just choosing what you control and allowing yourself to let go or disentangle yourself from outcomes that you can't control.
Yes, um, and keeping in mind, and I'll kind of, and this is a good example of my hybrid recovery. Um, so said in that way, I keep in mind what I can and can't control, and borrowing a principle from the 12-step program is, you know, I keep in mind that my higher power ultimately has control. And so circumstances and events in this life don't happen on my timeline.
Mm-hmm.
They happen according to my higher power, or if you don't believe in a higher power, they happen in accordance with the greater good of humanity or fate. However you want to think about it. But one thing that's consistent for everyone is that life doesn't occur on Brett's personal timeline. And so that really helps with anxiety.
Totally. Letting go of a personal timeline.
Yeah. Yeah.
Yeah, I'm recently, kind of recently, like in the last year, maybe also not only just knowing that, but like applying it to myself in ways that we can just let go, like let go of your perceived sense of control, which is what I think a lot of drug and alcohol use comes into play because we want to control so badly how we feel and how we experience life. Um, and I to me really important part of the addiction puzzle is this lack of connection with a higher self or source or god or this spiritual connection that we're actually i I don't like blanket statements, but here's one for you that we're severed from when we're in the throes of addiction, a drug or an alcohol addiction, especially, but those are just the ones I am most familiar with. Probably sex addiction and gambling addiction and all any sort of addiction that takes you away from feeling connected to your divine sense of self. Addiction severs that or blocks it or creates a really long journey back to it. But that is what is missing, and I think that that is what an addict or an alcoholic or someone who is using it's weird though. It's like that. It's a catch-22. We're trying to achieve that feeling, but it's the longest way to get there. And when you do reconnect with it and you maintain or establish or like make practices to feel connected to it as often as you can, like most recovered people that I know are people who are in recovery have are more morning people. They're like born again morning people, where you use that morning time to set that intention with feeling that connection in your body and in your mind and in your heart, because you have to have something to rely on. Life is really hard and scary, as we know, and we're all going to get hit with something, whether it be global or communal or in our own cities or countries or just in our own families or to ourselves. Like something's coming if it hasn't already. There's no escaping that. And if we feel like we have to fight that by ourselves, it's so weary and tiring and exhausting, and we are going to need some sort of solace or substance to make us feel better. But having this connection, I find either people come back to it through addiction or through the healing process of addiction, had it and then lose it and then come back to it, or find it for the first time maybe in their lives and on the healing process or in the healing journey. um, like you're describing, I have a same experience, and I think that's what's missing. That's really like that's the thing that is maybe one of, if not the most important thing to try to connect with or to bring into your life to get you through if you are someone who's in active addiction or beginning the healing journey of coming through the other side.
Yeah, and I have to compliment you. I mean, I have done a lot of reading on the subject of addiction and recovery, plus my own experience. But I've never heard it put that way, and I really like that. That addiction, whether it's a substance addiction or a behavior addiction, any sort of addiction severs your connection with whatever the source of your spirituality is. That's a great way to put it, and I would say that my experience is absolutely validates that. So I like that. I might have to borrow that in the future.
Oh, it came to me, so it's everywhere. I don't think that's my original thought. Actually, I had a boyfriend who, when I was in my early 20s, he was in his early 30s, and he had come through a really severe drug addiction, and I was still drinking and partying. And he was like, if you continue to do that, you are going to ruin your connection with spirit. And I was like, what does that even mean? Why is that important to me? Like, it didn't, I was like, when you're not ready to hear something,
Oh yeah,
it won't land. He meant really well, but I was more like, well, if you're not, I'm over here partying, so you're ruining my day.
right. What a buzzkill.
My total buzzkill. And then years later, as I'm going through this own journey myself, I was like, oh my God, Dave told me that in 2005, and here it is again.
That's
Yeah.
funny.
But it's like the thing that's the most accessible to all of us. And we forget that, or we're on a journey to remember that, or we just need more resources and people who are saying that, like, hey, this is a really powerful and accessible way out. And also a really powerful and accessible way to live your life without feeling like you have to control every outcome and that it's all on you, because it isn't.
Yeah, yeah.
Yeah. Tell me how this has pivoted you now, because I read, like, where did I read? In one of your bios, it's that you returned to medicine,
Mm-hmm.
and then but you had lost the heart. You didn't have the heart for it anymore. The fulfillment still was not there. There was like something else
Yep.
calling to you. Can you tell us about that pivot?
Absolutely. Yeah. So again, after I was out of work for 4 years, and so when I went back to work, and I have to say, I was and remain just extremely grateful and humbled for the individual responsible for basically getting me a job and allowing me to come back to work. Um, and even though I was extremely excited and grateful for that opportunity, I would say within 3 weeks or 4 weeks of being back to work, I realized that I liked it.
Mm.
It was okay. I liked it. But I did not love it anymore. I had lost my passion for clinical medicine, and it wasn't the patients. The patients were as wonderful as I always remembered. I love treating patients, but the work itself had lost the source of fulfillment that it used to provide, which was a good thing because I was learning that external validation shouldn't be the source of my self love anyway.
Yeah.
So, and this can really only be described by being the work of my higher power or of fate or however like you'd want to describe it. But a person that I trained with in residency, she and I reconnected, and she introduced me to life coaching, and told me that she was coaching surgeons. And so, long story short, over the last year, I've been training to be a life coach, and my calling is to help other doctors and physicians and healthcare workers who are experiencing symptoms of burnout, um, to help them manage those symptoms of burnout so that they don't um, hit rock bottom, essentially. And those that have hit rock bottom, help them to climb back out of it. And I use the same principles of psychotherapy that I was taught, plus all the principles that I learned in formal training, plus my own personal experiences to kind of connect with these physicians, because they're it's again one of these things that isn't logical, but there just isn't a substitute to connecting with someone who's been there,
Yeah.
who's been in the dumps, who's been in the cellar, who's been at the bottom of the hole, the way that you feel like you are. It's invaluable to connect to someone who's also experienced that. So I think that's probably what makes me a pretty good coach.
Yeah, I bet you are. I'm sure you are. And I love that there's like a specialty for working with doctors and surgeons, because unless you are a doctor or a surgeon or a nurse or someone who works in the medical field and knows what the taxation on your energy and your emotional and mental health is in working in those environments. Like one of my best friends is a doctor, and her experience, she tells me these stories of like what it took for her to get to where she is, but also how hard she grinds and
Hmm.
works her ass off. It's like, I'm like, my mind is like pull, pull, pull. Like I couldn't do that. It takes a specific kind of person with a specific constitution mentally, right? But these people, I think, and forgive me if this is an overgeneralization, but like people who are in this position are really high achieving, and they're like give, 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 and don't fulfill their own needs as much as they ought to be, perhaps because they're tending to so many other nervous systems, to so many other people. And so like I notice like in my practice I can really only work with like a few people at a time, because even if I'm not in the Zoom room with them or physically with them, I think about them, and like
Mm-hmm.
my state is attached to them. What about their well-being? Like there's an energetic exchange that happens between a caregiver or a practitioner and a client or a patient. Would you agree, or do you think that that's
Oh, I think I 100% agree. Yeah. Um, Absolutely. And you know, and I'll just speak for myself and physicians. That's one of the main stressors that we deal with, and that's one of the main causes of burnout, which is the time spent doing non-clinical, non-doctoring type work, paperwork, charting, talking with insurance companies. That kind of stuff is really, really taxing.
oh my god, all the
um,
unseen work that goes on behind
yeah,
the clinical practice.
yeah, and something I've learned over the last year and a half is that taking it all the way back, that feeling of boredom that I felt was starting to feel 5 years into practice. That exact feeling is an early symptom of burnout, and I would have never known that. And
Hmm.
so when I hear someone is describing this boredom sensation, um, that's a symptom of burnout. And so physicians, like you were saying, give, 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 and their self they put last. All of the symptoms of burnout, all of the symptoms of professional induced stress are seen at home first, and are seen in the personal lives first. So the patient care is the very, very last thing to suffer. So you can be in pretty bad shape from a burnout standpoint and still be functioning as an excellent healthcare provider, which is
Yeah.
scary when you think about it, you know?
But it's kind of phenomenal too. You know, the really strong like self-identification as being like, I am a doctor. Like it's really powerful. And so other things will suffer with my quotey fingers at the expense of that. Like I'm a doctor. Like, and maybe I'm a doctor first, and or I'm a physician first, and then I'm partner and father. Not, and it's not, I'm not creating like a value hierarchy on how someone might talk to themselves that way, but like I can see, I think a lot about how our identities are formed, and the thing that takes the biggest piece of the pie is the thing that wins. And if it's something that takes you over emotionally, like having an active addiction, that takes a huge piece of the pie. If it's your investment or your emotional investment and your energetic investment in patients or clients, that takes a huge piece of it as well. And then whatever's left is like what gets poured into the other areas of your one's.
Right.
Yeah.
Yeah, no, I would agree with that. I would agree with that.
Well, where can people find you, Brett? How can, if someone is who's listening to this is like, I am a doctor and I'm
Yeah.
experiencing these early signs of burnout or further along the road, how can people find you online? And I'll also put your links in the show notes, of course.
Yeah, just the burnout doc. So theburnoutdoc.com is my website. And then on Facebook and Instagram is also the burnout doc. And so there at my website, people could find different resources and sources of information regarding burnout. And it'll also walk you through how to get in touch with me. It starts with just a 30-minute free Zoom consultation, and we kind of interview each other, so to speak, to see if we're a good fit.
Mhm.
But that's free of charge. And then if we decide that it's time to get to work, it we do it over. I do it over an 8 to 12 Zoom session time period, usually 1 hour a week.
Mhm.
So that's what it looks like. But the website, you'll get everything you need at theburnoutdoc.com.
Cool. Awesome. Thank you so much, Brett. This has been my conversation with Brett Cordes at theburnoutdoc.com. Brett, thank you so much for sharing your story. Like, I got so much from it, and I'm so like honored to be in this space with you, and I really value people who are willing to share a private story like this because I imagine that it helps you further along on your path, but it also helps anyone who hears it who feels trapped in the darkness of not knowing that maybe they're the only one that's having this experience, or like what are some other ways that they can get out. Just knowing that somebody else has been through onto the other side is medicine in and of itself.
Yeah. Well, thank you so much. I was very happy to be here.
Yeah. I love having you. um, so thank you so much for listening. You can get in touch with Brett at theburnoutdoc.com, and I'll put that link in the show notes. And we look forward to being again with you next week on the Radical Healing Podcast. Have an awesome day.